Welcome to the Wellness Protocol, your source for guidance on metabolic health, hormones, and longevity. I'm Dr. Alessia Roehnelt, double board certified endocrinologist, and on each episode, I'll share simple tools rooted in science and experience to help you feel better, live longer, and take control of your health. Hi, everyone. Welcome back to the Wellness Protocol. I'm your host, Dr. Alessia Roehnelt. Today, we are going to be talking about something that many of you may be familiar with and may have actually been diagnosed with, which is something called prediabetes. This is a condition that I often diagnose in my patients, and I know that it can feel very scary and overwhelming at first. But here's the truth. Prediabetes is not a life sentence. What it is a warning sign. And it's also an opportunity because with the right types of changes and monitoring, you can often prevent the progression to full-blown diabetes. In many cases, you may even be able to reverse it altogether. So in this episode, we are going to talk about what prediabetes actually is and what it means. We're going to talk about how common it is, how quickly it can progress into full-blown diabetes. We'll also talk about the role of genetics. Is this something that came from your parents, or is this something that you are the first person in your family with? We'll also talk about dietary strategies that could be helpful in controlling blood sugar, as well as the types of exercise, how often you should be doing these types of exercise, and why certain exercises work. We will also dive into monitoring tools from simple lab tests you can have done at your doctor's office to continuous glucose monitors that you could wear 24/7. We'll even go into a little bit of evidence on some supplements that can help control blood sugar. So by the end of today's episode, you will have a clear understanding and a step-by-step roadmap for how to take control of your health. So let's start with the basics. Prediabetes means that your blood sugar is running higher than normal, but not high enough to be diagnosed as full-blown type 2 diabetes. There are three main lab tests that doctors will use to define prediabetes or diabetes. One of them is fasting glucose. That means what your blood sugar is when you haven't eaten anything in the last 6 to 8 hours. Most patients will have this test done in the morning, kind of just after they wake up. A normal blood sugar is under 100. Now, I'm a little bit more critical of this, and I think normal should be considered less than 95, because if your sugar is starting to go above that, it's a little bit of a warning sign that something's going on. But technically, prediabetes is diagnosed when your fasting blood sugar is somewhere between 100 and 125. Another test that we use to diagnose patients with prediabetes is the hemoglobin A1C. The hemoglobin A1C is a measure of how much sugar has been coating your red blood cells over the last 3 months, and it's given as a percentage. Now, normal is not 0. You do need some amount of sugar coating your red blood cells. But a normal range for this is somewhere between the mid-4s to about 5.6% or so. If your A1C is between 5.7% and 6.4%, you fall into the range of prediabetes. And a third test that we sometimes use to diagnose this is called an oral glucose tolerance test. This test is less commonly used because it does require a patient come in, have their blood work done, then drink a certain type of glucose drink, and then check the blood sugar a certain period of time later. So it is a little bit more cumbersome to do this test. But some women who have been pregnant may recognize this test from when they were pregnant and they had to do the glucose tolerance test. What we're looking for in non-pregnant patients is that if you have this high sugar load with a glucose drink and the blood sugar is between 140 to 199 2 hours after drinking it, that would also be considered prediabetes. In the United States, about 1 in 3 adults has prediabetes, but more than 80% of them don't even know it. And a really concerning statistic is that without any intervention, without making any changes to your diet, without taking certain supplements or medicines, without doing anything differently, just living your life, up to 70% of people with prediabetes will eventually develop full-blown type 2 diabetes. Now, the timeline for this, how long it takes someone to get to full-blown diabetes, absolutely varies. Many studies will show that each year, about 5 to 10% of people with prediabetes will cross over into that range of diabetes. So it's really not something to ignore. And I've absolutely seen patients in my practice where they do make a lot of dietary changes, they do make a lot of lifestyle changes, and they are able to keep off this type 2 diabetes diagnosis for years, even decades. But other patients, if they don't make those changes, they could progress to diabetes within months. So it really depends on the changes you make in your lifestyle to determine if this is going to progress or not. Now, let's also talk about genetics, because many people will feel very guilty or ashamed when they get diagnosed with prediabetes. They oftentimes put it on themselves, like, this is my fault, it's probably from what I'm eating, it's all of those candy bars, etc. But I really want to emphasize that insulin resistance, blood sugar problems, prediabetes, they are very, very genetic. If you have a parent or a sibling with type 2 diabetes, your risk of developing it is significantly higher. And certain ethnic groups have a higher risk, like Hispanic, Black, Native American, Asian populations. They are also at greater risk of developing diabetes. But genetics are not destiny. Think of them as loading the gun. Lifestyle is what pulls that trigger. So that means that what you eat, how much you move, how well you sleep, how you manage your stress, that will dramatically influence whether you actually get prediabetes or whether it progresses over time, or perhaps if it reverses. So let's dive into diet, because this is really one of the most powerful tools that you have when trying to control prediabetes. The number one strategy is to reduce carbohydrate intake from your diet, especially refined carbohydrates and added sugars. That's going to mean cutting back on a lot of the starchy types of foods, such as bread, pasta, rice, cereal, oatmeal, pastries, desserts, sugary drinks like juice or soda. And instead of having these foods, you want to focus on fiber-rich carbohydrates. Those would be things like vegetables, beans, lentils, maybe small portions of whole grains. Because low-carb diets, especially those focused on whole foods, have been shown in multiple studies to improve insulin sensitivity, to lower A1C, to reverse prediabetes, and help with weight loss. Now, when I talk to my patients about a low-carb diet, a lot of my patients say to me, well, don't I need some amount of carbs to live? Don't I have to have carbohydrates? And yes, you will have carbohydrates, because we are not talking about a zero-carb diet or a completely keto diet, but we are talking about having vegetables as your source of carbs instead of bread as your source of carbs. So even on this modified diet, you're absolutely going to be eating carbohydrates, but you're going to be eating those rich in fiber with a good nutritional value, not the ones that are just kind of empty calories, just starchy carbohydrates that will raise blood sugar. Now, the way you want to think about eating your meals is to have a good mix of all of these types of foods. So you want to mix in protein for sure, whether that's chicken or fish, eggs, lean beef, tofu, or legumes. Then you want to add your healthy fats, like olive oil, avocado, nuts, seeds, things like that. Then you want to give yourself those non-starchy vegetables. Think green leafy vegetables. Those are the ones that are going to give you a lot of good fiber and a lot of good vitamins. If you are going to include carbs like whole grains, quinoa, things like that, aim for smaller portions and always pair them with a protein or a fat. By adding protein or fat to a carbohydrate, you will slow the blood sugar spike. You will slow the release of insulin. You will feel fuller longer, and it will help to promote more weight loss rather than weight gain. Some other helpful strategies with eating carbohydrates. I would advise having a low-carb breakfast. That is because when you eat a lot of carbs in the morning, this causes a blood sugar spike. A blood sugar spike is followed by an insulin spike. And when your insulin level is high, that is a signal that is telling your body to store fat. So it is going to be much more difficult to lose weight when you are having a very high carb breakfast. So I always recommend to my patients to start with a breakfast that's either high in protein or healthy fats rather than carbohydrates. You also want to make sure that you are limiting your liquid sugar drinks. Those would not only be things like soda and juice, but also sweetened coffee drinks. I think a lot of people underestimate how many calories and grams of sugar are in some of the beverages that they're having in the morning. For instance, a pumpkin spice latte has 50 grams of sugar. That is the same amount of sugar as in 2 Krispy Kreme donuts. That's equal to about 12 teaspoons of sugar, which is a lot. And if you are having that first thing in the morning, again, blood sugar goes up, insulin goes up, that leads to weight gain, blood sugar crashes later in the day, you're not going to feel well. So really think about the beverages you are starting your day with as well. Now let's move into exercise, because exercise is another cornerstone here to controlling and reversing prediabetes. Now, you do not need to become a marathon runner in order to achieve this, but you do need to move consistently. There's really 2 types of activity that matter the most here. One of them is strength training. So by building muscle, it helps your body use glucose or sugar more efficiently. Muscle tissue is like a sponge for glucose. It can also help lower insulin resistance, which means improve insulin sensitivity. You want to aim for anywhere between 2 to 3 sessions of strength training per week, more if you can do it. But these exercises can include things like body weight exercise, resistance bands, weights, heavy weights, anything like that where you are focusing on building muscle, toning, and getting stronger. Those are the things that are going to help your body process sugar, metabolize it a little bit better, and work in your favor. But another type of exercise that I cannot emphasize enough is walking after your meals. Even a 10-minute walk after a meal can help to significantly reduce blood sugar spikes. And this really is one of the simplest, most powerful habits you can adopt. I don't want you eating a meal and sitting on the couch and watching TV, or eating a meal and going to bed. You need to eat a meal and move. It will help you digest the food, and it will help you process that glucose spike. If you can't get outside to go for a walk, walk around your house. If you are in a tight space, you can even walk up and down stairs. If you have no stairs, you can do standing squats in place. But something that is moving your body after you eat is one of the easiest ways to lower your blood sugar naturally, without the use of medicine, without the use of any fancy equipment. And while we can talk about numbers of minutes that you should be exercising every week, a lot of people say 150 minutes of moderate exercise every week. Honestly, in my opinion, consistency is more powerful than anything. So making a consistent habit of exercising for 15 minutes every morning is going to be incredible for your health overall and your blood sugar and your energy levels. Don't worry about always hitting a certain number. Just make sure you do it almost every day and make it a habit. So how can you monitor your blood sugar? How do you know if the changes you're making are improving your health? Well, there's a few ways to approach this. Number one is having labs done with your doctor in the office. Once you get diagnosed with prediabetes, you should have your fasting blood sugar or A1C monitored anywhere between every 3 to 12 months, depending on the person. If you are very well controlled, honestly, I think every 12 months is adequate. But if you are someone that is newly diagnosed, making a lot of lifestyle changes, it should be monitored about every 3 to 6 months. You can even go to the extent of checking your blood sugar at home using a home finger stick monitor. These are those devices where you do need to prick your finger and get a tiny bit of blood, and it will tell you in the most accurate way that we have what your blood sugar is at that moment. And it gives you that real-time, real-world feedback. But honestly, what I think is the most powerful device nowadays to assess your blood sugar control are the continuous glucose monitors. These are devices that they're very small. You wear on the back of your arm. They will monitor your blood sugar 24/7. So you will be able to glance at your phone or glance at a device associated with your continuous glucose monitor, and it will tell you what was happening to your blood sugar overnight when you were sleeping, what was happening to your blood sugar when you went for a run, what happened to your blood sugar when you had an apple, what happened to your blood sugar when you had an apple with peanut butter on it. And you can use this information to really personalize your diet and exercise regimen. Because as much as I can tell you that overall people should be eating low carb or overall people should be doing this exercise, everybody's body is different. And I have patients where an apple will make their blood sugar go through the roof. And in some people, an apple completely stabilizes their blood sugar. So knowing what is happening to your body when you eat certain foods is incredibly helpful, because then you can start to learn what is good for you, what is not so good for you, what you might want to eat every day versus what you might want to really just have on special occasions. You might find that certain exercises really reduce your blood sugar quickly versus other ones just kind of keep it stable. So it is a way for you to get your own immediate feedback on things that you are doing that could be affecting your blood sugar. I think one of the most incredible benefits of these devices is that they can also show you how much stress affects your blood sugar. Stress can mean an infection, stress can mean a broken leg, stress can mean a difficult conversation at work or an argument with your spouse or stress over something going on with your kid. But you will see on these devices that stressful events will absolutely cause increases in blood sugar. And while sometimes it's impossible to remove all stress from your life, you might just say to yourself, wow, I can't believe how much my job is impacting my health negatively because of all the stress. And it might just help you make more changes in your life to benefit your health long term. Now, in addition to diet and exercise, supplements can be helpful as well, but they are not a replacement for lifestyle changes. You can't out-supplement your way out of an unhealthy diet. But if you are looking for a little something extra to add in addition to a low-carb diet and routine exercise, you might want to think about cinnamon. So there are a lot of studies that show that cinnamon can help lower fasting blood sugar and improve insulin sensitivity. Now, the effect is modest, but again, it can be a helpful add-on to everything else that you're doing. The same is true of apple cider vinegar. There are studies showing that a little bit of apple cider vinegar can help to prevent blood sugar spikes. Some people will go as far as taking a shot of apple cider vinegar before breakfast, or they might dilute apple cider vinegar in some water and drink that in the morning. I think it makes more sense to just kind of add it to something like a salad where you naturally needed a little bit of vinegar. So let me use apple cider vinegar because I'll get a little bit more of a blood sugar benefit. There's also a supplement called berberine. This is a plant compound that has been shown in some studies to reduce blood sugar and A1C with effects similar to metformin in some cases. That's huge because metformin is one of the most common medicines that we use to treat diabetes or prediabetes. It's been around for decades, it's very safe, and it really has a dramatic effect on improving insulin sensitivity. So for berberine, a supplement to have similar benefits is really great because a lot of people feel more comfortable using supplements rather than a prescription medication. So berberine could potentially be another option. Magnesium is also important because low magnesium is really common in people with insulin resistance. So there is this connection between low magnesium levels and chance of developing diabetes. So supplementing with magnesium may even improve your glucose metabolism. And the last one is alpha lipoic acid. This supplement has antioxidant properties that may also help with insulin sensitivity. Now, of course, before starting any type of supplement, you always want to check with your doctor because the quality of the supplement and the dosing really matters. And if we want to get into medications to treat diabetes, metformin is a medication that we often use in pre-diabetes because it can prolong the development of someone going to full-blown diabetes. While I oftentimes first recommend that my patients try changes in diet and exercise, if you are one of those people that, in addition to that, want to layer on medicine just for almost a safety net or extra protection, it's not unreasonable. A lot of my patients have seen family members that have developed uncontrolled diabetes and a lot of complications from uncontrolled diabetes, and they are terrified of something like this happening to them. Metformin is very safe in general, and it does not lower blood sugar too much, so it is safe to use in people with just a little bit of high blood sugar. It's even used off-label for other treatments. Metformin has some anti-aging properties. Metformin can be used to help with fertility and pregnancy rates, especially in women with PCOS or polycystic ovarian syndrome. So there are multiple benefits to metformin that we see outside of just blood sugar control. So a lot of patients are also interested in a supplement like this. The downside to metformin is that some patients do get stomach upset with metformin. That might mean a little bit of nausea, or that might mean severe diarrhea. If you are one of those people that gets severe diarrhea with metformin, I generally tell you to just stop it because it's probably not going to be that effective for you anyway. Your body is telling you you're going in the wrong direction. But metformin is a possibility for people in the pre-diabetes range. Some patients also use the GLP-1 medications when they have prediabetes. The GLP-1 medications are those like Ozempic, Mounjaro, Wegovy, semaglutide. The thing is, they are not currently FDA approved to treat pre-diabetes, which means that most insurances are not going to pay for these medicines if you only have pre-diabetes. They usually will only pay for them if you have full-blown diabetes. And while that is incredibly frustrating, that is how it is right now. So the options would be to potentially pay out of pocket for this if your physician felt that this was a good option for you. The reason why they can be good options for people with blood sugar problems is that these medicines do improve blood sugar. It is very unlikely to have a low blood sugar on these medications. And many people with prediabetes are also fighting weight gain, obesity, high cholesterol, fatty liver, and these medications can also improve some of those medical conditions. So some patients in the prediabetes range will also opt to start a GLP-1 medication, knowing that it most likely will not be covered by their plan, but something that could potentially be a good option for them. So let's bring this all together. Prediabetes is very common, unfortunately. Again, 1 in 3 adults in the US. And it's serious, but it is also one of the most reversible conditions in medicine. Here are the key steps if you have been diagnosed. Number 1, you have to shift your diet. Lower refined carbs, less sugars, focus on protein, high fiber vegetables, and healthy fats. Number 2, you need to exercise regularly. You can't just go to the gym once a week and think that's going to be enough. You need to incorporate some strength training, but movement after meals is incredibly powerful at regulating blood sugar. So always make sure you are moving after a meal. Number 3, make sure you're monitoring your progress. You should be working with a doctor to make sure that your blood work is improving and steps you are taking are actually working. You also might want to consider doing some of this monitoring at home using a continuous glucose monitor or blood sugar checks. You also may want to consider supportive supplements like cinnamon or berberine or magnesium, again, in consultation with your doctor. Remember that there are medication options as well, especially if you feel like you've been doing all of these things and your numbers, for whatever reason, continue to get worse with time. You may want to consider starting medications. But remember, genetics are not destiny. Lifestyle really makes a huge impact here in this condition. So by taking action now and early on in the process, you can often prevent or significantly delay getting type 2 diabetes. And that will dramatically improve your health over the long term. Thank you for listening to today's episode on the Wellness Protocol. If this resonated with you, please share it with a friend or family member who may already have prediabetes or be at risk for prediabetes. And don't forget to subscribe so that you never miss an episode. I'll see you next week with more insights on hormones, metabolism, and longevity. Take care.